Hello, my name is Nurse Pauline RN. I hope everyone is good today. Today I'm doing part 2 on impaired skin integrity. Before I get started, please hit your like button, please hit your subscribe button, please comment and share this video, please. We spoke about documentation in my last video. When you're documenting your wounds, the patient comes up from the emergency room, you use your tape and you measure all your wounds. You document and sign your skin sheet. You document in the computer the length, the width, the depth of the wound. You will document the odor of the wound. You will document the color of the drainage. Is it purulent drainage? Is it serous drainage? Document what you see. You will document the BRADEN scale, and the BRADEN scale helps the nurse to predict the risk of patients to develop pressure ulcer. The BRADEN scale is documented every 12 hours, day shift, night shift. Each nurse documents once during the shift. The BRADEN scale, less than 9, is severe risk of developing pressure ulcers. The lower the scale is, the more severe the risk is. You should remember that. 10 to 12 is high risk. 13 to 14 is moderate risk. 15 to 18 is mild risk of developing pressure ulcers. So the higher the score is, the lower the risk is for the patient to develop the cubitus ulcers or pressure ulcers. We said in our last video, patients coming in with poor nutrition, we're going to do a wound nutrition consult. And patients with the cubitus ulcers, we would do the wound care nurse consult, the OSTOMY nurse consult, same person. This is a registered nurse. Only registered nurses stage wounds. Doctors do not stage wounds. You should know the definition of granulated tissue. This comes on most exams. Granulated tissues are red or pink, vascular, moist, rich, indicates good wound healing. When a patient is bleeding, common knowledge, first thing you do is apply pressure. Patients who comes into the emergency room, or maybe you're doing community nursing, patient with penetrating objects, nurses do not remove penetrating objects, only doctors or surgeons. These patients, the doctors usually ordered for the nurses to administer a tetanus shot for these patients. When patients are coming from the emergency room, the wounds are assessed by palpitation, and we will assess the wound. We're checking for edema. We're checking for cyanosis, blueness of the skin. We're assessing the skin for jaundice, skin lesions, symmetry, asymmetry. We are checking for edema in the skin. 1+ edema, 2+ edema. We have edema, 3+ edema, and 4+ edema. We have to document all edemas, all skin lesions, on the patient's skin. Some patients come into the hospital with lymph edema. These are our oncology patients. Maybe they had some surgery of the breast cancer. Maybe they removed nodes. These patients have lymph edema. We do not do blood pressure in that arm. Patients who come up from surgery, from PACU, with abdominal surgery, we'll give them a abdominal pillow. We can fold a blanket and just use some tape and give it to them to splint their abdominal wound. When they are coughing or sneezing or moving around in bed, this causes distress and they are more likely to be complaining of pain when they're getting in and out of the bed. So we try to make them an abdominal pillow or splint. Some patient coming up from the PACU OR, they have had abdominal surgery. The doctors would have ordered abdominal binders for them. They would have come up from PACU already with the abdominal binders on. Abdominal binders for patients coming up from the OR should not be removed without a doctor's order. We will make sure we have additional binders for the patients to take home on discharge. Do not wait until discharge day to make sure there is abdominal binders at the bedside. At least there should always be abdominal binders at the bedside, because fresh post-op patients, only a registered nurse, not an LPN, takes care of these fresh post-op patients. The patients, the binders gets a little bit bloody, so it's good to have one at the bedside. The doctor is the only one who changes the first dressing for a patient with abdominal surgery, not the registered nurse. We can reinforce the dressing, but we cannot change the first dressing, and that's a doctor's order. The binders gets bloody, so when the doctor comes up to do the dressing change, we will just give the patient another binder. Make sure it's at the bedside. The doctor can do it himself, or the nurse can do it if the doctor is too busy to put the binder on. But what you should know, binders are applied while the patient is lying down. Do not apply the binders when the patient is standing up for these fresh post-op patients. Binders are applied while they are lying down, and fresh post-ops, that's a registered nurse's delegation. Remember not to massage bony prominences. Massaging bony prominences can create friction in the capillary bed and causes skin necrosis. So we do not massage bony prominences. We just apply barrier cream to the prominences. We should avoid harsh soap on patients with impaired skin integrity. We'll use mild soap on these patients. Avoid harsh soaps. Serosangreous drainage is blood-tinged drainage. Purulent is exudates, indicates colonization of bacteria. Usually doctor asks us to do a culture swabs on these patients. Swab wound, we're trying to identify the kind of bacteria that is present in the wound. When the doctor identifies the kind of bacteria, the doctor will order specific antibiotics to kill or destroy that specific bacteria. So as soon as the doctor asks us to culture the wound, we will send it off to the lab. Patients coming in with burn. Remember, these patients are in a lot of pain. Make sure you're medicating them for pain adequately, and they should receive IV fluids. Doctors, for some patients with ulcers, the doctors will order a wound vac. A wound vac is a negative pressure wound therapy using suction pump with a tubing and a clear dressing to visualize the incision site, the wound site. So the dressing site is clear over the incision or ulcer, so we can visualize that wound. When a patient is on wound vac, first thing, make sure that tubing is not twisted. We should make sure the tubing is straight. We should document the color of the drainage coming from that vacuum pump or canister, or the drainage from the wound is in that canister. You document the color and the amount of drainage in that wound vac. Okay, patients who have decubitus ulcers or wounds, the doctor can order for them to go to Whirlpool. Whirlpool is done by the physical therapist, and what happens in Whirlpool, it debrides the wound. So before the patient goes to Whirlpool, make sure we give them enough pain medicine. It can be quite painful. Wound vac is ordered to remove excess exudate to promote wound healing. Remember, RN does the post-op patients, not the LPNs, fresh post-op. Assess signs and symptoms of infections for patients with ulcers, decubitus ulcers, wound, surgical incisions. Assess WBCs. Assess patients with elevated temperature. Patients, post-op patients, especially fresh post-op patients, assess them for signs and symptoms of hemorrhage. Signs of hemorrhage, lot of bleeding. Call the doctor as soon as possible to assist you. If patient is having shortness of breath, if the patient is short of breath, have difficulty breathing, having a lot of anxiety, please call the meds team. Patient with hemorrhage, signs and symptoms, low blood pressure. That blood pressure systolic is less than 100. Call the doctor stat. Come and see the patient would be helpful. Doctor, can you come and take a look at this patient if the patient is not symptomatic? Signs of symptoms of hemorrhage, low blood pressure, elevated heart rate, elevated respirations. Okay, that's all I have for you today. And I will be doing my next video following this about the stages of your pressure ulcer. Please hit the like button. Please hit your thumbs up button. Please share. Please subscribe. Take care. Be good. Love you all. Take care.